Hello. Today we're going to be discussing compression wrapping. Indications for compression wrapping are edema management and to treat venous insufficiency. So Ruth here is our patient, and let's see how we introduce this method of venous insufficiency control to her. There we go. So I come in. Hello, my name is Jonathan. I'm the student physical therapist and working with you today. Can I just have you verify your first and last name, date of birth, please?
My name is Ruth Giles Ott. My date of birth is September 7th, 1968.
Okay, excellent. Is it okay if you work here today?
Yes.
Okay, so today what we're going to be doing is something called compression wrapping. As you can see, you have some fluid buildup in your right leg. So the compression wrapping is actually going to help to improve the circulation, decrease that fluid buildup in your right leg, and push it through the rest of your body so that you can have normal circulation. While we're doing this, you're going to feel some pressure as I wrap your leg. I'm going to be trying to increase the pressure going from the bottom of the leg going up the leg, lessen the pressure, just so I can kind of push the fluid out of that area and back into your body. You shouldn't feel any type of extreme pain. We're going to do this so that we can get your leg back to normal size. You can get back in the pool.
Yay!
How does that sound?
Good.
Okay, cool. So without further ado, let's get started.
Contraindications for compression. Number one, congestive heart failure or pulmonary edema. 2, recent or acute DVTs. 3, thrombophlebitis or pulmonary embolism. 4, severe PAD with an ABI less than 0.8. 5, acute local skin infection. 6, significant hyperproteinemia. 7, acute trauma or fracture. 8, arterial revascularization. Those are the contraindications for compression, and precautions are: number 1, impaired sensation or mentation. 2, uncontrolled hypertension. 3, cancer. 4, CVA or TIA. 5, superficial peripheral nerves. And then those are the precautions. Adverse effect is increased temperature, further aggravating existing edema. 3 is ischemia.
So you can just sit here on the edge and scoot back a little bit forward. Okay, so now I'm just going to take off your shoes and your socks so I can put on the compression wrap, okay?
Inspect the skin, check for any possible local skin infection, and judging here, don't see any signs of infection, and we're gonna wrap the medial and lateral malleoli for our compression wrapping.
Now that we checked that the skin is good, before we get started, we want to make sure that the foot is in a neutral position. Normally we would be placing foam pads over the malleoli, but for demonstration purposes, we are just going to go ahead and wrap right over it. So the technique that we're going to be using is called a herringbone. Now, you want to keep the patient in neutral, but if they can help you doing so, they can do it. So we're going to go here. Run the line of the toes. Make sure we have no creases. That's 2. And now we are going to start our wrapping technique. So we'll bring it down and we'll bring it upwards. And now we want to make sure that there's more pressure in the bottom and less pressure on top. just like so. And if we need to make it go a little bit higher, we just tape it here and have the second layer just keep following it on the way up. So that is the wrapping that you want to have.
So the question is, if the patient begins to experience adverse effects to the compression wrapping, what is it that the physical therapist assistant should say to the patient? If the patient experiences increased temperature, further aggravated edema or ischemia, we should tell the patient to remove the compression wrapping to avoid any possible harm to the patient. They should return to the clinic and we'll do the wrapping again. This is also why it's important to communicate with the patient and make sure that the wrapping isn't too tight before they leave.